Hey everyone, Dr. Erik here from MedBetterHealth, where we help you, the caregiver, with everything dementia. Okay? Today we're going to talk about a very important topic. We're going to talk about a word called anosognosia. What? Dr. Erik, what does that mean? Well, you'll find out in this video. You ready? Let's go. So, it's not denial. Why dementia patients refuse help? Let me ask the folks listening there in the virtual world. How many times is it that you come up to your mom, your dad, and you're saying, Mom, you got to take your medications. And she tells you, I took my medications. And you tell her, but Mom, I'm looking at over here, you have 10 medications a day, and I left this morning and you still have 10. What are you talking about? I took those medications. Those are from yesterday. Mom, it says Monday here. I did the math. And it's a vicious cycle. And you're trying to prove to Mom that she did not take her medication. And your mom is saying, I did take these medications. By a show of virtual hands or comment below, how many of you have a similar story that you go in and out day to day? I'm sure there's a whole bunch of you right now raising your virtual hands or commenting below. So what's the fight that's happening in thousands and thousands of homes, right? Take a look. Well, number one, the caregiver's reality, current risk, observation. You are observing that the bills, and let me get my little writer over here, that the bills are unpaid. You're observing that the food has been spoiled in the refrigerator. You are seeing this. You're observing that Mom and Dad are asking the same questions over and over again. What is the patient's reality? The patient does not see the bills are unpaid. They genuinely believe that they paid the bills. They genuinely do. They genuinely believe that they did not ask you this question before. Or you're observing there are dents in the car that are new. Mom's getting lost when she's driving to the local grocery store. Or here's another situation, as we talked about, the medication is forgotten 3 times this week. And so the patient's reality is an outdated self-image. Response: my daughter is wrong, I did take the medications. The doctor is wrong, I don't have dementia. Response 2, there's nothing wrong with my driving. You just want to control everything that I do. I don't know what it is with you, Nancy, but lately you've just been controlling everything that I do. Does that sound familiar? Or, I took my pills, I'm fine, and look, my blood pressure is all good, right? So, the caregiver is responding to the present day risk. However, the person living with dementia is responding to an outdated self-image. You may think they're stubborn, but it's not stubbornness. Well, Dr. Erik, if it's not stubbornness, then what is it? Let's take a look. So there's something called anosognosia. Wow, that's an interesting word. Well, what does that mean? Well, let's look at the actual Greek roots. It means without knowledge of disease. Okay, and what is it? It's a symptom of neurological condition that prevents a person from recognizing their own cognitive impairment, memory problems, or functional decline. And the way I want you to think about it is, all of us have a mental dashboard, right, around us. So imagine that my car has a fire inside and it's getting overheated, and everyone around me sees that there's steam coming out. But I'm looking at my dashboard, and my dashboard says that everything is fine. There's nothing wrong with me. There's nothing wrong with my car. There is no steam. Everyone else sees the steam, but I'm focused on my dashboard, but my dashboard is broken. My dashboard is not connected. So what happens here? Before you call it stubbornness, ask whether their brain still has access to the awareness, because you're asking them to be aware of the fire, but their dashboard shows that the temperature is okay. So the difference between denial and anosognosia is this: in denial. Oh, mom's just in denial that she can't drive and she's getting old. Mom's just in the denial that she's forgetting to take her medications. The difference is denial. I want you to think about it as a software problem. That's a problem in the software of the individual, right? And you could fix the software, right? There's a bug in the software. When it comes to anosognosia, there's a hardware problem. The actual hardware doesn't work, and the hardware is unable to say that there's a problem. The hardware says everything's okay to the person, but it's not okay. So if you want to distinguish between denial and anosognosia, denial is psychological. It's a software problem. Anosognosia is neurological. That's when they say, nothing's wrong with me. They're not denying it. They genuinely believe within their hardware that everything is okay, that they took their meds. It's not a denial. It's I took my meds. And so it's an actual neurological, physiological problem, right? In the root cause in denial is the person is not ready to emotionally accept the truth. They're just not ready to accept the truth. They understand it. The hardware processes it, but they're not able to accept the truth. Whereas in anosognosia, there are actual brain changes that have what? That have destroyed the pathways required to self-awareness. Those actual pathways have been destroyed, and you can't get them back. And so when you look at the internal monologue, in denial, the person is saying, I cannot emotionally face this situation. In anosognosia, my brain genuinely does not recognize this. So to look at it, required intervention. In denial, you gotta have to spend time, emotional support, and therapy. Whereas in anosognosia, even if you spend emotional support and time and therapy and you explain something, the hardware doesn't work. There's no connections there anymore. And so you can't now, if you're trying to go from this spot, right, let me make it a little bigger here. If you're trying to go from this spot, if you're going to try to go from this spot to this spot, you could do it, right? Why? With denial, you can work through emotion, through time, and you're going to go here. Well, in dementia, right, in anosognosia, you're over here, and you want to go here, and there's a line, but then it broke. You've got this gap over here. You can try all you want to explain, to educate, to prove, to say you took your medications, ma. You're not safe to drive, ma. But no matter what you say, they have anosognosia. That message will never cross here. So what you need to do is you need to have structural workarounds. You're not going to be able to go from here to here because, as we say, there is a gap here. But you're going to have a structural workaround, which we're going to discuss in this video. Okay, let's keep it going. And very, very important, if you treat anosognosia like denial, you will keep trying to convince them with facts, and facts will only create conflict. Facts will only create conflict in anosognosia. Now, the brain's internal inspection system is broken. Step 1, action. The person performs a task, for example, managing pills. Step 2, monitoring. The brain usually monitors for errors and compares the current performance and abilities. Step 3, in anosognosia, as I showed you, there's actual a break in the frontal and the parietal lobe of the brain. There's an actual break. So they can't pass from here to here. Step 4, there's a false output. The dashboard reads system normal. No errors detected. That's because it wasn't able to have the signal, the right signal, come here. Because there's a hardware problem. Okay, now, if we take a look at the highly common, highly combustible system, 20 to 80% of individuals with Alzheimer's disease and dementia experience anosognosia. 20 to 80%. That's a huge number. And if you look at it, in a 2024 study, loss of awareness because of anosognosia was directly linked to neuropsychiatric symptoms, agitation, paranoia, delusions. All of these things are connected. And the double problem is the person doesn't recognize they need help, and they perceive your help as criticism, control, or an actual threat. And then there's this trial lawyer trap, right? We call it the trial lawyer trap. Very interesting. You're going to go and present evidence. You're going to say, Mom, you didn't pay the bills. Mom, you didn't take your meds. The patient brain cannot process this deficit. Okay. Then what does the patient feel like? They feel like you're attacking them because they think they paid the bills. You're telling them they didn't pay the bills. So what emotion are they feeling? They're feeling attacked. They're feeling confused. They're feeling like you're gaslighting them, right? And what is their response then? They respond with fear. What's going on? They're trying to take all my control from me, from paying my bills. They're taking my car away. Are they trying to steal my money, right? There's anger. I've raised my daughter and my son, and now they're treating me like this. There's shame. And that loop keeps on going every day, every day. And I want you to be aware of it. It's called the trial lawyer trap. You as a caregiver are trying to tell them what the reality is. You're presenting evidence. You're presenting facts. You think the facts are going to change things. Remember, anosognosia, their hardware doesn't work. And therefore, your facts are not going to be processed by their CPU computer. Why? Because these facts don't matter. The hardware doesn't work. The neurons are not jumping from one place to the other that they should. And so caregivers often overestimate the patient's abilities to understand and comprehend. And what does this lead to? Increased frustration and depression. Now, not only does it cause increased frustration, depression, agitation in the person living with dementia, but it causes, and studies have shown, anosognosia. If you don't know how to properly walk around it, it will cause you to have caregiver distress at higher levels, much more higher levels. So, when we look at all this, this is what you want to do. Stop forcing insight. You want to stop forcing insight. Stop forcing facts. It's not going to work. The caregiver's fantasy, this is the fantasy world. If I just explain it enough, if I just present enough facts, they'll understand and they're going to be safe and everything will be okay. That is a fantasy, right? It's not going to work. The realistic goal is, I know they still think they are fine. They have anosognosia. No matter what I, the caregiver, do, they will not understand the facts. So first, I've got to admit that. Second, therefore, I'm going to design an environment and I'm going to figure out how around the corner, not straight, but around, going sideways when I talk to them, not directly, you cannot drive, but through a side door. What does that mean, Dr. Erik? What do you mean? So the practical goal is never to make the person agree they have dementia or they can't do something. The goal is to reduce the risk while preserving dignity. Do not build every intervention around the phrase, Mom, because you have memory problems. Mom, because you have dementia, we now have to do X, Y, Z. No, use this approach. This is called the side door communication strategy, not the front door. You're not going from the front. You're going from the side. What does that mean? Well, let's look at it. Here's a caregiver. And the caregiver is saying, that's the front door, Mom, you cannot drive anymore. That's the front door, right? You cannot drive. That leads in the patient's brain to say, what do you mean I can't drive? I've always driven. I'm okay. So you hit the locked door. You lead to arguments and higher risk. Let's go to the side door now. Path B, structural and validating. Mom, the car right now, the insurance went up. It's in the shop. We're going to get it back. But for now, let's take an Uber because I have to figure out this insurance problem and the cost went up almost double. We'll try to figure it out. Here's another example. Mom, you're not paying your bills. I see that the mortgages, they're about to take away the house. Mom, you have dementia. You really have to let us handle it. Side door. Mom, you know there's this technology now and everything's on auto pay. And the bank told us that if we do auto pay, we can save a couple of $100s a month. So we've put everything on auto pay so that now we don't really have to think about it. It takes care of itself. I never mentioned to Mom she has dementia. I never argued that I'm taking away her control. I just said, there's a side door. There's a new opportunity to do auto pay and we'll save a couple of bucks as well. What's the result? It bypasses the need for insight, for facts, for aggression, and it leads to acceptance and safety. The other thing that works very well is when you are a caregiver and you're telling your mom to do something, your mom's going to say, no, I don't want to do it. But when you use, and studies have shown that if you say the doctor recommended, now you don't want to just use it for everything and overplay it. But if mom's not taking her meds, you say, but look, I spoke to the doctor, Mom, and look, this is the letter from the doctor. And the doctor said over here on this letter that you should be taking your medication. It's not from me, it's Dr. Smith. Many times it works like a charm. So try the doctor said we have to do it. All right, but you don't want to do it things that a doctor actually didn't say. So I hope this video was very, very helpful, right? Understanding the problem and understanding the real reality, understanding the term anosognosia, that the hardware will not process my facts. The CPU is not working. So no matter how much facts I drop into that CPU, the bridge is broken and the data is not going to transfer. So what I have to do is I have to use the side door, understanding that you'll never win with facts or insights, but you'll win with side door approaches will cause you to be a lot more successful as a caregiver when you're talking to your loved one. So I hope that you found this information helpful, and I'm sure you did. And I'm sure you're wondering, wow, this is great. Now I have these tools and these resources that I'm able to leverage to help my mom. So there's a couple of things I want to tell you. The reason we can do this now is because my organization called MedBetterHealth has been selected by Medicare to participate in a new innovative model called the GUIDE model. It stands for Guiding an Improved Dementia Experience. This model is incredible. First of all, it's fully covered by Medicare, and it's for persons living with dementia. But the key in this model is to focus on the caregiver. What can we give the caregiver? Or imagine a world where you have a care navigator, one-on-one, kind of like concierge, where you have access to her or him, and they are able to educate you on things like this. Or imagine a world if at 10 o'clock at night, your mom is acting a little strange. She's telling you, honey, I see a ghost. I see a ghost. And you know, you're like, oh my God, what do I do? Imagine if you have a 24/7 hotline and a helpline where you can call and there's a social worker there who's trained on dementia and a registered nurse and a team, and that they say, oh, really, let us walk you through that. And they walk you through that problem and you know who to call. And imagine if it costs nothing, you don't have to change your doctor, you don't have to change your insurance, and everything stays the same. And imagine a world if you're exhausted and you just need a break. You literally just need a break. And this new program will say, don't worry about it. We, Medicare, through the MedBetterHealth program, guide program, will pay for a private duty home health aide to come to your home to relieve you so that you can go with your daughter, with your son, with your husband or your wife out and enjoy, have breakfast, have lunch, and someone will sit there with mom at no cost? Well, that's what the guide model is. So if you're interested in learning more about this program, very, very easy. You see the link, click on the link, and go to the link. It's right on your screen. There's a QR code as well, and the link's also in the description. And when you click on the link, and you'll be able to see there's a video there talking about the incredible guide program. And then there's a simple form to fill out. You put in your information, we contact you, and your life changes for the better. I want you to do a couple of things. Number one, I want you to like this video. It's super important. I want you to subscribe to our channel. I want you to also, you'll see over here, there's going to be a link to our courses where we have over 30 videos talking about 10, 15 minutes each, talking about each and every aspect of dementia, whether it's my mom's not eating, my mom doesn't want to take a shower, and a whole bunch of other things like that. I hope you found value from this. Take advantage of the guide model. Apply today. You don't want to miss out on this opportunity because we're getting so much interest, obviously, in this program that, you know, time may be coming where there may be a waiting list, and we don't want you to miss out. So I'll see you soon, and I'll see you on the next video.